When I joined the National AIDS Control Organization in 2005 end, it was December 2005, first of all, I was very reluctant to get in because I was Principal Secretary in Andhra, and I had got several very, very important health reform issues cleared by the Chief Minister. I was on my way to really bring in several changes and a lot of reforms that were badly needed in the state. And it was at that time that I got this promotion and I had to shift to the federal government. And when I went in, that National AIDS Control Organization was a complete story in disarray. There were a whole lot of people not talking to each other, in fact fighting with each other. There were people who were looking after areas which they were not competent to do. There was no strategy, there was no direction, and it was a laissez-faire kind of a situation where each one could do whatever they wanted. And there were the donors who were behaving very, the prima donna kind of role, that they knew everything and they had to tell NACO what to do, and they would have their own person. So in fact, a time came where there was absolutely no alignment between who was doing what, and the government was completely on the defensive. Every time a guest would come to India, particularly in winter, they all arrive from the US. They never come in summer, so it's always November and December. And and they would come and say, oh, India is sitting on an atom bomb, its actual number of cases are 25 million, and they're still in denial. They're just saying it's only 5 million because the official figures showed about 5.1 million were the estimated number of infected people. And they would just keep coming and making some statement or the other. I remember once Richard Feasham came and said, circumcision is supposed to be so good and so an excellent form of prevention, and India is not taking it up. Now, India dare not take it up because of the so many religious associations given to this whole, so science is one thing, but translating it and putting it into a policy sometimes becomes another thing. So then there was a big uproar that what is, he's saying and so on. So India was very much on the defensive on this whole battle of HIV, and if you remember, in 2005, HIV was literally globally the sexiest topic to talk about. It had the highest amount of resources. It had a very high level of political attention from the US president downwards. So it was in that kind of an environment that I was brought in to set NACO right, and honestly I didn't think that I would ever be able to get anything done. But the first thing that really I sat down and I said, now what do we do? And the first thing that comes to anyone's mind, I mean, the most important and critical issue if you want to make a difference is to have the instrument to make a difference with, and that's your organization. So long as NACO doesn't matter, as long as NACO is in such a disparate and issue without any direction, no one's going to pay attention to you. So the first thing that I had to do was to get rid of the people. And since I was in the ministry before, I knew most of them. So it was sometimes hard to say, sorry, but you may be good, but you're not up to the mark to the challenges that we face today. So send away some people, get some more who are competent. And then the government had only sanctioned 50 posts. That's 50 people who could work in NACO, and I needed something like 150 people. So the remaining 100, we did massive contracting. So in a year's time, we recruited another 100 to 150 people, and I sent my teams. We just didn't advertise and seek, because everyone's CV looks very good. So, it's you can't go by CVs. So I had sent my teams to the best schools in India on social work, and who have, on rural management. We have some very good institutes. So they went there and did campus recruitment, and I got some of the finest students who topped those schools to come and work with me, and I paid them very well. So, and that's how we built a critical mass of extremely bright and motivated students, people who came and worked on a contractual basis with NACO, and we quickly, got the organization up and running within a year's time. Now, since I had got these very bright minds, and we spent a lot of time on their training, in fact, I even sent some of them to East West Center to understand how you do analysis, data analysis. That was considered to be one of the best institutes around. So while we were ramping up the entire quality assurance and all these methods, I had to be careful of the donors, because anyone who's praised by me, donors would offer him a job and take them away. So I had to keep the donors on leash. So I had to call them and said that any one of you poaching on even one of my people, you're out of business with India. You may leave the next day. The airports the doors are open. So you dare touch any one of them. They were petrified. And they really took me. They were so petrified that one of my officers did apply for a UNAIDS job, and the guy rang me up, "Can I see his application?" I said, "No, you can't." Say quickly. So because they get the field experience in NACO, which is what the donors want. And they want these people. So I then had a meeting with them, and I said, "Look, you guys, your success depends on my success. It's NACO's is the only one which can really scale up and achieve the goals of HIV response. And if I'm weak and I'm decapacitated by your taking away my people, and then you come to help me build my capacity, it's a no-sum game. We can't keep going in circles." So I said, "Don't do that. You please strengthen me by bringing me the best people around. And sometimes the best also need more money than I can afford as a government. So you please put your people here and work as one team." And I think they saw the sense in that, because, frankly, from their point of view, for the last 5 years, there was absolute zero leadership from NACO, and they were not really getting anywhere except holding workshops and seminars and workshops and seminars. So therefore, here they found that I was somebody trying to do business. And so therefore, Gates Foundation, USAID, UNAIDS, they all pulled together, and they really did get extremely talented, very experienced senior people to work as a technical support unit, but within NACO. In fact, DFID used to have a technical support model where they would have a technical support unit, but so far away from NACO office that I had to, I used to forget they were there, and they'd wait for my call to tell me how to support me. So I said, this doesn't work. You've got to be inside NACO. You have to take responsibility for the advice you're giving, and you better be a part of the whole team. Blame, shame, credit, or whatever it is, you're a part of the whole story. So that's how I opened my doors wide. Windows were open, and I allowed anyone to come in and work with me shoulder to shoulder. So that was getting the donor, and then support. And then the most important thing thereafter was, what's the strategy? We don't have a strategy. How do we build one? So in this building of the next 5-year strategy in 2007 was it was very innovative, because I'm a dyed-in-wool bureaucrat, and bureaucrats just work within their own four walls and with their own organizations. So this was something extremely new, and I really took to it very quickly, fortunately, was that the strategy was being built in the public open. I mean, there were people living with HIV/AIDS, there were civil society organizations and NGOs, there were donors, there were all these stakeholders, there were doctors, academicians. They could all comment on the strategy as it developed and evolved. And anyone could give me, if they had done any pilot project anywhere, they could give me their evidence, and we found that evidence worthwhile to work a strategy, intervention around it, we would use it. So it was a very, very participatory process. And it was, the previous 5 years, if $500 million was the budget, for the next 5 years, we took it up to $2.5 billion, and we got the money. So it was a 5-fold increase in the budget, which normally, as you know, budgets would increase only 10% incrementally year on year. At best, you can double it if you're very fortunate. But we had a 5-fold increase, and everyone said, how can you get that kind of money? And we did. Because if you have a good strategy, you have a good organization which is willing to provide you the leadership, and you have alignment of all the stakeholders, then it is possible to make a good case to get the funding. And that's how NACO was built, very much based on evidence. We had a lot of surveillance sites that were really, that's called sentinel surveillance. We had about 700 of them. In a year's time, we increased it to 1,400. We doubled the number of sentinel sites. And the treatment was hardly 20 or 25,000 when I joined. and by the time I left, it reached more than 300,000, and I think it's now 500,000. Now, the important trick on what I found most satisfying was how I learned on the job, and the biggest challenge for me was how to scale it up. How do you scale up interventions throughout the country? So, and for that, we also felt that you just opening centers and positioning people is not enough, because the quality of treatment that you get in Kerala, you should be able to get the same quality in Kashmir. So that brought us to the concept of standardizing every intervention. Every intervention was costed. Every intervention had an operational guideline. The operational guideline could be read by any one of you who don't know anything of the program, but you'd get insights into saying what are the aims and objectives of this particular intervention, who is the target group, what is the amount of money that is to be spent on a unit of that intervention, what are the kind of skills, competencies, capabilities that are required, what are the kind of personnel that you need, and what is your monitoring format, and who do you monitor at what frequency and when. So it was these operational guidelines for every intervention. So by the time I left, we had 18 operational guidelines for every intervention, and these then helped to standardize. And it was the structure that we had given to NACO. The teams, each intervention had, or one or two interventions had a team, and these teams, their responsibility was to go to the states, have these explain the standards and the guidelines, and also enforce them. So the second most important thing that went into scaling up the implementation was very, very intensive reviews. My level every Monday with my division chiefs, and then once in 2 months with the state aid society project directors, and then the teams from NACO would go in-depth reviews in different states. And every team that would go out to a state had to say what they were going to be looking out for, what are the problems that the state is facing, and what are the problems that they're going to address in their visit, and what were the problems they had visualized and have they been implemented, the decisions taken in the previous visit. So they were accountable for these visits, not that they just went and chatted up some people and came back. They were very purposeful, and I used to get all my feedback through the review notes that these teams would come back and give me. So I literally knew everything that was happening throughout the country. So that's the first hallmark, I think, of leadership. I think there are two things. One is being accessible. My telephone number was known to everyone. The last sex worker to my next in command would know my cell phone number. So anyone could ring me up anytime, and no matter how busy. That's a discipline I maintained even when I had a tougher job as a union secretary, that I would always respond back to SMS or to a phone I got, because you never know who's giving you what information and how important it is. So one is that access is something that I learned when I joined service in early years, and that's a habit that has really paid a lot of dividends to me. And the second is listening, therefore, to what the field tells you. And the third most important thing was getting these reviews done. And when you go to the field, it's just not a question of what have you done with the money we have given. It's not that kind of auditing. You're really training them, you're patting them when they've done good work, you're nurturing them, and you're building in leaderships at the local levels. Because at the local level, when people do good work, they want to show it. They want somebody to come and acknowledge it. So it is this kind of eye contact, as I used to tell my officers, that we should know the people who are implementing projects in the field, and they should be feeling a part of the whole exercise that we are doing, and they must understand why they're doing what they're doing. In my entire career, this again right from day one, was that if I'm really a good leader, then after I leave, what I have done should continue to work. I always assess myself as a bad situation, and a leader is bad that he goes and everything collapses. So I have this immense satisfaction that even after I left NACO and I went to the union secretary post, things have continued. And once you put in systems, and once you put in organization structures, and you put in those instruments of governance, then whether the people on the top are good or not, as passionate or not, they can only make a 10% take it forward or take it backward. And this used to be an issue that used to keep coming from the donors. what after you leave, what will happen? We're trusting you, you're there, but you can be transferred out. So I said, no, then don't give it to me. You put in systems, you help me to put systems that whether I'm there or not, whether somebody else comes in or not, the systems must function. So this